45% of Americans now say they approve of the Affordable Care Act. That's the Health Care Act, of course. 50% say they disapprove. Now, that's still a net negative, but that's actually slightly more positive than the last time we measured it, which was back in August, when just 41% said that they approved. That's very interesting. Some theories had it that because of the problems with the health exchanges, which are an integral part of the ACA, Americans might be down on the act overall. But that's not the case. These data taken after the government shutdown showed the actual uptick in approval, which indicates probably that the shutdown's effect overall was to increase positive sentiment towards the ACA rather than decrease it, even though the shutdown was in large part premised on the efforts by some to try to defund or otherwise change the Affordable Care Act. Now, Democrats have become more positive. They were already positive back in August, but look at the change here. They've jumped up from the 70s to the 80s in terms of approval, and that's where a lot of the change came from. Something about this time period from August to now caused Democrats to be more positive about the act. Republicans, on the other hand, were negative in August, very negative, as you see there, and they're very negative now. 86% disapprove of the Affordable Care Act. Young people who are critical to the ACA, because they tend to be the most uninsured, and therefore it's most important that they sign up for insurance. Well, at least attitudinally, they're pretty well positioned because they're the only age group that are more positive than negative about the ACA. So that's good news for proponents of the ACA. At least you have more young people in your pocket, so to speak, liking the ACA than is the case for those who are older. Bottom line here, as we update approval for this critically important milestone in American healthcare legislation, we find a slight uptick to 45% of Americans approving, still more negative than positive, but compared to August, a little more positive than it was. I'm Dr. Frank Newport, Gallup Editor-in-Chief.